Hi, I'm Elizabeth Turner with Georgia Family Connection Partnership.
And I'm Rebecca Rice, also from Georgia Family Connection Partnership. Today, we're going to explore the findings of the 2019 Georgia Civic Health Index. So come find out what civic health is.
Stay tuned. Good afternoon. My name is Elizabeth Turner. As Brian said, I'm with an organization called Georgia Family Connection Partnership. Just by a quick show of hands, how many of you are familiar with Georgia Family Connection? Great. I will not spend and belabor who Family Connection is, but very quickly for the couple of you who are not familiar, we have a collaborative in all 159 counties in Georgia, looking at their data on child and family and community well-being, and bringing a cross-section of the community together to improve conditions for their local children and families. And then Rebecca and I work for Georgia Family Connection Partnership, which is the state-level public-private nonprofit based here in Atlanta that supports that network of Family Connection collaboratives. So we were thrilled to partner with you guys on the Civic Health Index, the 2019 Georgia Civic Health Index, which is the second iteration of this publication. The very first edition of this was published in 2013, and then we had a series of years where we didn't have one, and then we were happy to bring it back this year. So the first question I want to answer for you guys is, what is civic health? Civic health is a term that was coined not by us, but by the national nonprofit, the National Conference on Citizenship. They work with organizations all over the nation to produce these reports at the state level, and we are pleased to be their partners in Georgia. And what we mean when we say civic health, or what the National Conference on Citizenship means, is basically civic engagement plus. So not just your traditional measures of civic engagement, which you might think of as voter registration or voter turnout or interacting with our public officials, but also how do we interact with other people in our community. So really, how do we all interact with our neighbors, our institutions, with each other, as family members even. So really, just social cohesion, how do we all interact in community is what we mean when we say civic health. So this is why Family Connection cares about it, and I'm sure GMA, you guys as well, won't speak for you, but this is why we wanted to get involved in this body of work. We know that communities that have higher levels of civic health have all sorts of positive community outcomes that are correlated with that. So communities with higher levels of civic health have lower crime rates, better public health outcomes, stronger workforce development, economic resiliency, particularly during economic downturns, improved mental health among both adolescents and adults, and improved adolescent well-being overall, reduced mortality, and reduced unemployment. Hopefully we can all agree that these are things that we want for our communities. So that's why it's important to take a look at these data. So what did we find out when we published this year's report? Unfortunately, both in 2013 and in 2019, Georgia was below the national average for most of the measures for civic health. And I'm going to turn it over to Rebecca because she's going to dive into specifically what that looks like and what it means for the state of Georgia right now.
I work for the Georgia Family Connection Partnership. I'm the Georgia Kids Count Manager. Hello, everyone. So like I said, for almost every measure of civic health, Georgia lags national averages. What we found overwhelmingly, both in 2013 and in 2019, was that higher income and higher educational attainment strongly correlate with higher levels of civic health. Specifically, individuals who make over $75,000 a year and who have at minimum a bachelor's degree have much higher levels of civic health. But when you look at Georgia's demographics, that our median income is around $55,000, and the majority of our residents don't have a bachelor's degree. So when we see these data, it tells us that there are a lot of people not participating on a regular basis. So I'm just going to go through some of our data highlights. Lowlights might be a more appropriate term. So how does Georgia do in terms of national ranks? So we are 40th. And I should say these are survey data, and I'd be happy there's methodology that we can talk about later on. So we're 40th in voting in local elections. We're 44th in volunteering, and we are 49th in contacting a public official. We're 44th in discussing political, societal, or local views with neighbors. At just 7.7% of respondents said that they do that. And we're 45th in working with neighbors to do something positive for your neighborhood or community. Less than 20% of respondents said that they do that. We're 49th in group membership, and this one surprised me. We are 47th in the nation in donating to charitable or religious organizations. So a lot of these kind of challenge the way, I'm a native Georgian, kind of challenge the way we think of ourselves as Georgians. I thought we would do better. Turns out we don't. So we're 50th in frequently hearing from or spending time with family and friends, and we're 50th in frequently talking with or spending time with neighbors. I will say, technically speaking, 50th isn't dead last. This is out of all 50 states and the District of Columbia. So 51st is dead last. So we're not dead last. We're one away from dead last. Yeah, not great. However, when we looked at different demographics and sliced the data in different ways, we did find some other trends. We found that rural residents did report frequently talking with or spending time with neighbors at higher rates than the state or national averages. And we also found that residents with annual incomes of less than $35,000 reported talking or spending time with neighbors at a higher rates than residents with higher incomes. And that was actually the only indicator for which the lowest income bracket outperformed the highest income bracket. And so here are some places we're actually right in line with national averages or a little bit better. So we're 29th, which is right in line with the national average, for frequently talking to or spending time with people of different races, ethnicities, or cultural backgrounds. And we're 13th of the nation in posting views about political, societal, or local issues on the internet or social media. It's still only like 10% of respondents, but still, that is the only indicator for which Georgia outranked national averages out of all 21 indicators. 49th in contacting public officials, but 13th in posting issues to social media. We're also 29th in the frequency that Georgians provide food, housing, money, or help to extended friends or extended family. And we found that also Georgia millennials and Hispanics actually engage in this way higher than state or national averages. So say what you will about millennials, they are taking care of their friends and families. So I think we're going to take questions at the end if there are any data questions. So I'm going to turn it back over to Elizabeth. There you go. Got it?
Great. So I just quickly wanted to go over what the report say are some of the best practices, and then I'm going to talk a little bit about what we're doing in Georgia to help improve these data that you saw. So these are based on research. These are not Georgia specific, but we know, as Rebecca pointed out, that people who have higher educational attainment participate more frequently in civic life. And so improving overall educational attainment in your communities is actually a strategy for improving civic health. Also implementing high quality civics education. We know across the nation, the trend is that civics education is on decline in our school systems. And so implementing high quality civics education is one strategy, and we're going to talk a little bit more about what's going on in Georgia around that. Increasing opportunities for volunteerism among both youth and adults. Volunteerism tends to be tailored for specific groups of people. So looking throughout your communities and seeing what are the barriers to volunteering. Volunteerism is highly linked with employment. And so that's a really, really important one. Ensuring opportunities for civic participation among all populations. That one pretty much speaks for itself. And then modifying built environments to encourage face-to-face engagement. I think this is one particularly that city officials can have influence over. Supporting and promoting vocal in local and national elections. And then also from the report, capitalizing on the fact that local government enjoys a higher level of trust than state government. So this is another place where city officials specifically can leverage an opportunity that already exists. So specifically, local governments are perceived to fix real day-to-day problems and that they get things done. They readily partner and are present and responsive to their residents, frequently use data or other hard evidence to determine the best course forward, and make decisions without regard to partisanship. So we see this as an opportunity for city officials to really leverage this trust that already exists and to build upon that. So what are we doing in Georgia? This is specifically a body of work that Georgia Family Connection is involved with several of our partners. So the first, of course, is the report. You can't know where you're headed until you know where you are. And so we always begin our work with data and looking at the data. And so the Civic Health Index was an important part of that. Once we produced the 2013 Civic Health Index, we had a lot of communities step up and say, I really want to know what my local community looks like. The survey data that produced the state report don't allow us to drill down to the local level. It's just not a large enough sample size. So we had 6 communities that really said, you know what, I'm willing to put some resources and get some partners to the table to replicate that survey and implement it locally so we can figure out exactly what's going on in our community so that we can begin to move forward. So we're going to talk a little bit about an example of that in just a second. iCivics is an attempt to look at that best practice, which is high quality civics education. It's a national online evidence-based free civics curriculum started by Sandra Day O'Connor, who was worried about the decline of civics education across the country. We've been partnering with the State Bar of Georgia to help get the word out about this resource, not just in school systems, but also in community-based organizations like Boys and Girls Clubs and after-school programs. Public libraries have really latched onto this, and now Family Connection has a couple of folks who are going around the state and can provide free training thanks to the bar's support on this civics curriculum. And then, of course, you guys, I'm sure, are very familiar with the 2020 census efforts. We really see that as part of our civic health work. Because if you're not willing to fill out a survey that says, I reside in the state of Georgia, you're probably not doing any of the other things. And so we see that as a first step to getting people involved. So when we say cohort, back to the slide here, the local civic health cohort, this is what we mean. So we have 6 counties who said that they were interested. So that's the identification part. And then we're supporting them with data and research, strategic planning and strategy implementation, helping them get partners to the table and communicate all of their work and their findings and supporting all of that work with evaluation. So this is a model that we use not just in civic health. We've done cohort work around low birth weight and early education and lots of other things, but civic health is our most recent example of cohort work in Georgia. So this is how we select the counties or communities that are interested in or are going to participate in a cohort. The first is interest. We don't go out and say, you guys need to participate in this cohort and this is the issue. Obviously, we let communities decide that they want to participate in this, and that's where we start. We also look at the data and say, where is there a need? Is there readiness? And we like to have geographic diversity when we can as well, so that we have large examples from different types of communities throughout the state. So here are the communities that are involved in the civic health cohort. You can see we have geographic diversity all over the state of Georgia. We have some larger counties, we have some smaller counties population-wise, and now we have data sets for all 6 of these communities that can be compared to the state report. So Rebecca's going to take back over and go a little bit deep on the Macon Bibb one, so you can kind of see an example of once we have these local data, what a community can do with it and how they can start to improve their rates of civic health.
Cool. So yeah, this is really just an example of one of our community-based efforts around the civic health work. So in Macon Bibb, this is some of the methodology that they use to implement this survey at the local level. It was led by Family Connection collaborators and key partners. It was done via hard copy as well as a random digit dialing. So it was a multi-methodology data collection. And then these are some of the data they gathered in terms of looking at demographics. They're actually about to do data collection 2.0 because from these are the data they gathered versus what the demographics we would expect to see for American Community Survey estimates. And that's a lot of data stuff that I can talk about later. But anyway, they found that generally speaking, they oversampled older residents and white women. So they're actually going to go back and resurvey to make sure that they have a more representative survey sample. But what they did find in terms of the actual questions, you'll see that in terms of frequently discussing political, societal, or local issues, Bibb County respondents said they did it at 44%, whereas the Georgia rate was 37%. So in Macon Bibb, they outperformed there. 37% of Macon Bibb residents said they volunteered in the last 12 months, compared with 26.5% at the state level. And then 26.3% of Macon Bibb residents said they attended a public meeting, compared to just 10% of Georgia residents. I will say there was a bit of a crisis in Macon Bibb last year, so that may have helped inflate that particular number. But so it's some stuff that there's certainly the numbers are still not where they would like them to be, but they see these as pieces they can latch onto to improve community outcomes where they see they're higher than the state rate. And these are just a few of the kind of buckets of civic health work that Macon Bibb has now built out. They have built a civic health strategy team that has members all kinds of community members from different sectors, including Mercer University. They're working on the Civic Health Survey 2.0 to get a more representative survey sample, and they are creating a Civic Ambassador program in Macon Bibb. And a couple of pieces of those larger strategies. They're implementing iCivics with multiple community-based partners. They're doing ID and voter registration. They have what's called On the Table. It's the civic dinners that some of y'all may have heard of, civic dinners. And then they are also part of their local complete count committee for Census 2020. So that's, like I said, that's just kind of an example of one of our communities that has chosen to take on civic health work and what it can look like at the local level. And again, all of our communities, they really do, they make local decisions, but we do support them with research and best practices like the Civic Health Index and local data. Okay, and then I'm going to let Elizabeth close it out with some good news.
So back to iCivics. Again, civics education we see is a really important piece of the puzzle here. And so, as I mentioned, we're working with the State Bar of Georgia to help get information out about iCivics. Free, I will say that again, because that has been really important to a lot of our communities. The website is iCivics.org. And so this is our rate of registered teachers by year of iCivics. You can see we've had exponential growth throughout Georgia. We got this from the analytics from National iCivics. So Family Connection got involved about right here in helping get the word out about this to community-based organizations. And so we really think that's an opportunity to go outside of the classroom, because we know teachers have a lot pressing on them that they may not be able to get as much of this information during the school day, but there are other opportunities, and it seems to be working. And then finally, another, just an example of where we think we've seen some system changes. We attended the Georgia Council for the Social Studies puts on a conference for social studies teachers all over the state, and we were very excited and surprised to find out that they had an entire breakout session broken down from K through 12 by grade level, focused on the Civic Health Index. And so they used the Civic Health Index as kind of the baseline to share with all these social studies teachers at one of their conferences with over 400 attendees. And then they had content experts come in and say, okay, this is the problem that we're having in Georgia. Let's figure out how to teach this in the classroom. We didn't even know they were going to do that. We had shared this report with folks at the Department of Education and a couple of small social studies teachers groups, and apparently it caught on, and we see this as a real win, because this is an opportunity where a system is being changed because of this report, because of this data report. So just wanted to highlight those for you as a couple of kind of wins for our state. So here's our contact information. We are happy to answer any questions. That was a lot of information in a short amount of time, but we're happy to answer questions now or follow up with you afterwards. Thank you so much.